This episode is sponsored by HomeAglow. So let's be real, letting someone into your home to clean is a big deal. I wanted to feel safe and confident in who I was inviting in, and that's exactly what made HomeAglow such a standout. It was so easy to browse reviews, see photos, and choose a trusted cleaner with experience, someone I could feel good about right from the start. If you haven't heard of it yet, HomeAglow is a top-rated home service platform that helps keep your space clean and tidy. Whether you've got guests coming over, a party to prep for, or just need help keeping up with life, HomeAglow makes it simple. You can book a cleaning online in minutes, choosing the exact day, time, and duration that works for you. Cleaners go through a rigorous certification process and maintain an average rating of 4.8 stars. And the best part? 100% of cleaning fees and tips go directly to your cleaner, so you're supporting someone in your local community. Their Forever Clean membership is also a game changer. It saves you $30 an hour on every cleaning, and you can book unlimited cleanings starting at just $19 an hour. And they're backed by HomeAglow's Happiness Guarantee. Take home cleaning off your plate this summer by using HomeAglow. Head to homeaglow.com/nursemo to get your first 3 hours of cleaning for only $19. That's HomeAglow.com/nursemo. Hello, I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach nursing concepts and share tips on how to thrive in school and at the bedside. Today we're going to be talking about a foundation concept that once you know this concept, it actually helps you understand quite a few other really important concepts for nursing. So before we jump into that, let's take a quick minute for our shout out, which goes out to Georgia, who says, "The scariest thing for me in nursing school was by far dosage calculations. I could never keep the formula straight and constantly second-guessed myself. The Confident Calculations program teaches a method that is absolutely foolproof as long as you follow the steps. It gave me confidence and removed all anxiety about medication math." Georgia, thank you so much for sharing that. And yes, I agree. Learning one way to do things is so much more efficient, so much easier than trying to juggle different formulas for different types of problems. So if you're interested in getting the confidence that Georgia has, you can check out Confident Calculations. I'll put a link to that in the episode notes, or you can just Google Confident Calculations. I also teach all of this inside Crucial Concepts Bootcamp, which is my nursing school prep course. You can find that on the straightanursingstudent.com website as well, and also the link in the episode notes. So again, we're talking about a foundation concept today. This lesson covers the renin-angiotensin-aldosterone system. You'll also see this referred to as RAAS, R-A-A-S, or the RAAS Pathway. And when you know this system, you have this really important foundation knowledge that will help you understand several really important key concepts like endocrine function, fluid balance, hypertension treatment, heart failure treatment, and no less than 3 classes of medications. Now, if you've been in my free class, which I titled How to Thrive in Nursing School Without It Taking Over Your Life, then you know what I'm saying or what I'm talking about when I say that if you can learn one thing that helps you understand multiple other concepts, you will fast track your nursing school learning. Again, that class is called How to Thrive in Nursing School Without It Taking Over Your Life. It's totally free. I'll put a link to that in the episode notes as well, or you can just go to straightanursingstudent.com/thrive. Okay, so we're talking about the renin-angiotensin-aldosterone system. What is the role of this system in the body? So RAAS has 2 primary functions in the body. It's going to help maintain appropriate fluid volume, and it regulates systemic vascular resistance, or SVR. Now you might be wondering, wait a minute, what's systemic vascular resistance again? So SVR is the amount of force that the vasculature is exerting on that circulating blood. You may also hear this called total peripheral resistance. Same thing, SVR and TPR. If somebody talks about those, they're talking about the same thing. So there are three things which determine SVR, or systemic vascular resistance. So one is the length of the vasculature. Number two is the viscosity of the blood, how thick that blood is. And number three is vessel diameter. So of these three, which one do you think is the most variable from moment to moment? We're not really going to change the length of the vascular bed, right? And blood viscosity, yes, we can change it. We can give fluids to help make the blood less viscous, but even faster is we can change vessel diameter. So that is the most variable component. So when the vessels constrict, this causes blood pressure to go up. That's why when I worked in the ICU, so many of our hypotensive patients would be on a medication that we would call a vasopressor. It pressed down on those vessels, constricting them and increasing blood pressure. And when those vessels dilate or get bigger, then blood pressure goes down. Both volume and SVR play a role in cardiac output, which, as you know, contributes to blood pressure. So in a nutshell, RAAS functions as an important component of blood pressure regulation. So there are three key components of RAAS. They are renin, angiotensin, and aldosterone. Remember, this is the renin-angiotensin-aldosterone system, RAAS. So renin is an enzyme. Remember from your physiology class that enzymes are biological catalysts that increase the rate of metabolic physiological processes. Basically, they make things happen. So renin is released by the JG cells of the kidneys when blood pressure and renal perfusion are low. And then angiotensin is a hormone. Recall that hormones are molecules that are produced in one part of the body but trigger a specific reaction in a target tissue or target organ in another distant part of the body. And remember, hormones can be excitatory or they can be inhibitory. There are multiple forms of angiotensin, and the one responsible for the effects of the RAAS pathway is angiotensin 2. And then we have aldosterone. It's also a hormone. It is created from cholesterol and produced in the adrenal cortex. Aldosterone helps regulate salt and water balance in the body. So that's your three components of RAAS: renin, which is an enzyme, and then angiotensin and aldosterone, which are both hormones. So now let's talk a bit more about this pathway and how it works. So the renin-angiotensin-aldosterone system is activated by three different mechanisms. One is detection of decreased renal perfusion pressure. So basically, blood pressure gets low, the kidneys don't get perfused as well as they should. The body detects this, it activates RAAS. So that's one. Another is the detection of low sodium levels in the body. And three is through activation of the sympathetic nervous system. Any one of these three things will kick RAAS into action. So what happens when RAAS is activated? First off, we have renin, and renin is released by those JG cells of the kidneys. And renin, because it's an enzyme, it's going to do something. Renin converts angiotensinogen, which is a protein produced in the liver. It converts angiotensinogen into angiotensin 1. Now, angiotensin 1 doesn't really do anything, but it passes through the vasculature of the pulmonary system and is then activated by something called ACE, ACE, angiotensin converting enzyme. So I'll say that again. Angiotensin 1 passes through the vasculature of the pulmonary system and is activated by ACE, which is angiotensin converting enzyme. ACE converts angiotensin 1 into angiotensin 2. And angiotensin 2 has a ton of jobs. First off, it increases SVR through vasoconstriction. It stimulates the reabsorption of sodium at the renal tubules, and it stimulates the pituitary to release antidiuretic hormone. It also increases thirst to encourage fluid consumption. So a person whose RAAS has been activated might feel more thirsty. In addition, angiotensin 2 facilitates the release of norepinephrine, which is another potent vasoconstrictor, and it tells the adrenal cortex to release aldosterone. Another function of angiotensin 2 is that it stimulates something called cardiac hypertrophy, and this comes into play in cardiac disorders such as chronic hypertension, myocardial infarction, and heart failure. So that was angiotensin 2, and then aldosterone is that final hormone, and it stimulates the kidneys to increase sodium and fluid retention. So let's talk through that again. Renin is released by the JG cells of the kidneys. Renin converts angiotensinogen into angiotensin 1. Angiotensin 1 passes through the vasculature of the pulmonary system and is activated by ACE, which turns angiotensin 1 into angiotensin 2. And then angiotensin 2 is going to cause vasoconstriction, stimulate the reabsorption of sodium, so keeping hold of sodium, which means keeping hold of water, stimulate the pituitary to release antidiuretic hormone, make the person more thirsty, and release norepinephrine as well as aldosterone. Aldosterone stimulates the kidneys to increase sodium and fluid retention. So all of these actions together achieve two key things. One is increased fluid volume, and two is vasoconstriction. Now, with increased fluid volume, what happens? We have greater preload, we have greater stretch of the cardiac muscles, we have higher cardiac output. And with higher cardiac output, what do we have? We have higher blood pressure. Now, vasoconstriction increases that systemic vascular resistance, which then leads to increased blood pressure. So essentially, the end result of RAAS activation is higher blood pressure. I just got my Echo stethoscope and wow, this thing is a total game changer. Even after 14 years as a nurse, I still have moments where I second guess what I'm hearing. If you've ever felt this way, you're not alone. That's why I'm so excited about what Echo Health is doing. Echo pairs the classic stethoscope design with powerful audio amplification and advanced AI to help you detect heart and lung conditions earlier and with way more confidence. It amplifies sounds up to 40 times, making it easier to hear even in chaotic, noisy environments. Hello, emergency room, and hello, ICU. It also helps you detect murmurs and AFib more accurately, and you can even record and share sounds with physicians for faster collaboration. And want to hear a bonus? Echo's technology is backed by more than 4 million heart sounds, and users are twice as likely to catch heart disease early. What I really love is the visual readout of heart rhythms. It's like having this cardiology consult right in my pocket. Honestly, I don't know how I practiced without it. I trust Echo so much that I worked with their team to create a special offer just for my listeners. Right now, you can get $50 off plus a free customizable chest piece cover at echohealth.com/nursemo. Your purchase is HSA and FSA eligible and may qualify for CEUs. Plus, Echo guarantees you'll detect heart and lung conditions more confidently. If you don't, return it for a full refund. Go to echohealth.com/nursemo for $50 off plus a free chest piece cover. That's ekohealth.com/nursemo.
Summer's here, and Nordstrom has everything you need for your best dress season ever. From beach days and weddings to weekend getaways and your everyday wardrobe. Discover stylish options under $100 from tons of your favorite brands like Mango, Skims, Princess Polly, and Madewell. It's easy too with free shipping and free returns, in-store order pickup, and more. Shop today in stores, online at Nordstrom.com, or download the Nordstrom app.
So now you might be wondering, well, why do I need to know this, Nurse Mo? Well, I'll tell you why. Because you're going to come across medications and conditions that have a lot to do with this RAAS pathway. The key ways you're going to see this pathway coming into effect or coming into context with your patients is with hypertension, hypotension, and with cardiac dysfunction, heart failure, myocardial infarction, things like that. So let's talk a little bit about each of these and the pharmacology of the RAAS pathway. So looking first at hypertension. When a patient has hypertension, a lot of times we're going to give medications that disrupt the RAAS pathway. Now, there are 3 classes of medications that achieve this goal: ACE inhibitors, angiotensin receptor blockers, and aldosterone receptor blockers. So ACE inhibitors such as lisinopril, so a little tip here, ACE inhibitors end in pril. So ACE inhibitors such as lisinopril disrupt angiotensin converting enzyme. They are ACE inhibitors. They're not going to let that enzyme do its thing. And what did that enzyme do? It converted angiotensin 1 into angiotensin 2. So if we disrupt that, we're not going to convert Ang1 into Ang2. Since angiotensin 1 is an inactive precursor, it's not going to have any effect on blood pressure. And that's how ACE inhibitors keep the patient's blood pressure lower. The other class of medication I mentioned is angiotensin receptor blockers, or ARBs. These disrupt the pathway by blocking angiotensin altogether. An example of this is losartan. These medications end in sartan. And then aldosterone receptor blockers, such as spironolactone, disrupt the pathway by blocking aldosterone and preventing the body from holding on to salt and water. The result is less fluid retention, and you'll often see spironolactone used as a diuretic. You'll hear it called a diuretic because with less retention, we actually have more fluid losses. So you might see that with spironolactone. Now, a key thing to know about spironolactone when you're looking at it as a diuretic, it's going to be a lot different from furosemide. Whereas furosemide causes potassium losses, spironolactone does not. So if your patient has any risk for hyperkalemia, they could have hyperkalemia if they're taking spironolactone. Okay, so that is hypertension. We're going to give ACE inhibitors, we're going to give ARBs or angiotensin receptor blockers or aldosterone receptor blockers or a combination of these medications. But what about hypotension or low blood pressure? Believe it or not, there are cases where we actually want to enhance the RAAS pathway. And this is essentially going to be cases where we need to increase blood pressure in severely hypotensive patients in septic shock. And we do this with a medication called Giapreza, which is essentially pharmacological angiotensin 2. I did get to use this medication when it was pretty darn new when I worked in the medical ICU. And it worked really, really well. And it was really interesting. And I did a whole episode about it. If you're interested in learning more about Giapreza, you're going to go way back in the podcast archives and listen to episode 48. Oh my gosh, that's an old one, but it's a really interesting drug. So if you're interested in learning more about it, go and check that out. And then the other condition where we're going to see the RAAS pathway kind of manipulated is in heart failure. So medications that disrupt this pathway are used in heart failure because let's say you've got a patient with sustained activation of the RAAS pathway. This is going to contribute to or worsen heart failure due to vasoconstriction, due to fluid retention, due to cardiac remodeling, which are changes in the heart structure and size. We don't want any of that. So by disrupting the effects of angiotensin and aldosterone, patients with heart failure have less disease progression and improved quality of life. So your heart failure patients, your patients after myocardial infarction are often going to get some kind of medication that disrupts the RAAS pathway to prevent that cardiac remodeling, to prevent fluid restriction, all those things that can contribute to the heart not functioning properly. So there you have it. That is your quickie overview of the RAAS pathway. If you want to review more foundation concepts like this one, I do review 6 of the most critical concepts from anatomy and physiology in my nursing school prep course, Crucial Concepts Bootcamp, which I mentioned earlier. I'll put a link to that in the episode notes. Thank you so much for joining me today and for being a fan of the podcast. I hope that it helps you be an even more amazing nursing student, even more amazing nurse. And if you haven't yet, start following the show or subscribe to the show so you never miss an episode. If you're new here, I do quickie episodes on Mondays and more in-depth episodes on Thursdays. If you have not yet also rated and reviewed, please do so. When you do that, it helps other people find the show and it helps me see everyone that I'm reaching because really you are the motivation for doing this and I appreciate you so very much. I'll see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com. Feeling excited about nursing school until the overwhelm kicks in? I've got you. Crucial Concepts Bootcamp is your nursing school prep, but not the fluffy kind. We cover time management, medication math, clinical skills, and actual strategies you'll use starting on day one. It's like a cheat code, but ethical. Sign up and give your nursing school story a solid head start and save 20% until August 11th. Go to straightanursingstudent.com/bootcamp.